This is a Founding Media podcast.
Hey everyone, I'm Dr. Ramdeen, and I'm an internal medicine physician. I'm also a National Academy of Sports Medicine certified personal trainer. I've been really interested in fitness and nutrition for about 10 years now, and I have a pretty diverse background. I've worked as a hospitalist, which is taking care of sick patients in the hospital, and also in the long-term acute care setting, which is like a hospital type setting where patients go if they're not quite ill enough to remain in the hospital, but not quite sick enough to go home. I've worked in acute rehab settings, and I've been held medical directorships in the nursing home and hospice. I did my residency training in Ann Arbor, Michigan. I also did my chief residency there. And then I went to North Dakota to practice hospitalist medicine and was an assistant clinical professor at the University of North Dakota, where I taught a lot of medical students in the hospital. The teaching that I've done has been the most enjoyable aspect of my career. And this podcast channel is really just a natural continuation of that passion. And the goal of this podcast really is to integrate the world of medicine with the world of fitness in a way that promotes a healthy lifestyle through three pillars: nutrition, physical activity, and primary care with your physician. I look forward to helping you understand the links between fitness and medicine. And after studying both of these areas, I believe that it is essential to combine the two. And the podcast is also really an extension of my private concierge practice, the idea for which was spawned in part by me working in the transplant hospital, where I saw a lot of 20-year-olds and 60-year-olds, young patients. And yes, 60 is young. We see a lot of 90-year-olds and 100-year-olds. But these patients, they're, again, 20s to 60s coming in with liver failure or kidney failure, and they're ending up on the transplant list. And some of these patients are taking supplements that are really popular supplements that they're purchasing at very popular places and facilities, but they're not being monitored by their physicians. So why is this happening? Well, the typical outpatient medical practice setting is overwhelmed with patients who have active issues or acute issues. Like, for example, if you look around your doctor's office and look at who's in that office, you'll see patients there, again, with active issues, like maybe they just had a heart attack, or maybe they're following with their doctor because they just had a stroke, or maybe you'll see somebody in there who's having a flare of their asthma and they're wheezing or having difficulty breathing, or someone's there to maybe talk about the management of their diabetes, etc. It's rare you go into your family doctor's office or internal medicine doc's office and see it filled with majority of patients there eager to discuss their preventative care with their physician. And so as a result of that scenario, there's a lack of basic education with regards to preventative care. And also, frankly, a lack of blood test monitoring to assess organ function like liver function, kidney function. And this is a function also of busy schedules. In this digital age we live in, patients are really busy, and the docs are really busy because these waiting rooms, again, are filled with patients who have very acute issues. They're sick patients. And secondly, a common anecdote that I hear a lot in patients that approach me wanting to, have interest in my practice are, tell me the same story over and over again. They tell me that they've asked their doctor about advice on how to cut fat, how to build muscle, are protein shakes safe, what type of supplements do I need? And they feel like they're getting brushed off when they get their answer from their doctor. And again, I believe that this is a factor of those really busy waiting rooms that I mentioned. And it's just that the doctors are trying to work within the time constraints of the hours of that day, trying to take care adequately of all those really sick patients in that waiting room. And on top of that, the amount of paperwork that doctors are required to do in that setting is ridiculous and a topic for another day. So I think doctors are doing their best to work within the time constraints of our current healthcare system. But I started my concierge practice because I didn't want to work within those constraints anymore. I wanted to spend more time with my patients by diving into their nutritional habits and diving into the types and the frequency of their physical activity and determining how to optimize their specific blood test results to complement or even accentuate their efforts towards attaining their unique fitness goals. In order to deeply dive into lifestyle and give my patients the time that I felt they needed, I realized that concierge medicine was really the only way to do this effectively. Concierge medicine is a practice model, it's a model where the patient panel is smaller and the doctor is taking care of less patients. But because of that low patient volume, more time and attention can be paid to those patients whenever it's necessary. And also, the nice thing about concierge medicine is that my patients reach out to me directly. So they avoid the rigmarole of having to call their doctor's office and be placed on hold, talk to a secretary, maybe be told they'll get a call back later and maybe they were doing something else and missed the call. There's none of that. And again, under this model, more time can be spent on preventative care versus after the fact care. So, for example, I spend the majority of my time talking about issues and assessing for things that can lead to a stroke or issues that can lead to a heart attack versus spending the majority of my time managing those issues after they've already occurred. So, my goals in doing this podcast is to help you understand the effects and the safety concerns of taking supplements and the rationale and the safety issues related to nutrition, and of course, discussing how to prevent and treat diseases. I'll be interviewing guests to help me explain these issues to you while first and foremost, keeping your safety in mind. If I've done nothing else throughout this podcast but make you aware of how to stay safe while engaging in nutrition, fitness, or primary care strategies, it'll have been worth it. And I want to say there's so many ways to engage in these strategies effectively. There's so many different types of great workout regimens, so many good ways to attack your nutrition strategies, but there are also so many ways that you can get hurt. And my goal is to limit the latter. This channel is unique because it's rare for there to be a physician to present issues like this online and talk about these issues, and I want to change that. If you're interested in becoming a member of my practice, feel free to go to ramdeenmd.com. Also, if you head there, you can check out my YouTube channel that I launched for you to be able to learn about topics in medicine and fitness. And if you're on Instagram or Facebook, you can follow me there for updates as well. And by the way, feel free to message me on any of these platforms, comment on the videos or posts that I'm putting up there. And even if there's a topic that I'm not addressing, please feel free to ask questions and I'll always do my best to answer them. Finally, I'd like to thank Founding Media and the Long Center for hosting me here during South by Southwest. And thanks so much for tuning into this new podcast. See you guys next time.